My name is Dina Smith. I am an oncology social worker at Cancer Care. I'm the caregiver program coordinator there. Cancer Care is a nonprofit based out of New York tri-state area, but we do help people nationwide. My specialty is working with caregivers, and today I'd like to give you a little bit more information about the essentials regarding caregiving. All right. So, in terms of learning objectives for today, so my goal for today is to help all of you identify the definition of caregiving, to help all of you understand the roles and responsibilities surrounding caregiving, to identify self-care practices in order to alleviate burnout, and to identify symptoms of burnout. So let's just start with the basics. What even is a cancer caregiver? So it's anyone providing care to a loved one who that person can be considered a caregiver, although not everyone defines what they're doing as caregiving. So what does that even mean? Well, a lot of you probably and beyond obviously took on this role of caregiver because you love your loved one. Maybe you're their spouse, maybe you're their child, maybe you're their parent, and you thought, yeah, this is a no-brainer. But it's really important to understand that you have taken this extra leap of faith in yourself and both in yourself and in your own abilities in order to be able to provide physical and emotional support to your loved one. It's not an easy feat. So I do just want to identify that it is a very, very difficult and heavy responsibility, and you should be proud that you've taken it on. So there are so many different types of caregivers. There's long distance caregiving where maybe you're not even in the same house. Maybe you are across town, across state, even across the country, maybe even in a different country. You could be local. Maybe you're a few streets away. Maybe you are living within the same household as your loved one. You could be more of an emotional caregiver, meaning you provide more support in terms of being there for your loved one mentally. So being a shoulder to cry on, allowing your loved one to vent to you, being a listening ear. Or perhaps you provide more practical caregiving, meaning you transport your loved one to and from doctor's appointments. Or perhaps you are figuring out, the bills, taking care of the finances, etc. You may be a family member to the cancer patient, or you could even be a friend or a neighbor. And then let's not forget that healthcare professionals can also be considered cancer caregivers. So all types of and definitions of caregiving are valid and should be a definition that belongs to you. So no matter if you are a long distance caregiver and all you're doing is providing a telephone check-in every so often to your loved ones, seeing how they're doing, yes, you are in fact a caregiver. And so let's go a little more into the responsibilities of caregiving. So as I mentioned, there are both physical responsibilities and there are emotional responsibilities. And you don't have to just be in one category. You can give maybe 3/4 physical responsibility and 1/4 emotional responsibility. It's whatever is unique to you. But so some of the most common responsibilities that I see in terms of the physical are transporting your loved one to and from doctor's appointments, taking care of household chores, making meals, assisting with ADLs. An ADL is an activity of daily living, meaning clothing yourself, bathing yourself, washing the dishes, things like that, that sometimes we take for granted. Administering medications, scheduling medical appointments, and advocating for your loved one in and out of the medical office. In terms of emotional responsibilities, I see a lot of lending a listening ear, being a shoulder to cry on, checking in with a phone call, an email, a text, a FaceTime, being vocal about or sitting with your own feelings. So telling your loved one how you're feeling about the situation, because they may want to hear that. And last but not least, advocating for your loved one. So we see the advocating component here in both columns, and I put that in both columns because you can consider it as both a physical responsibility, but also an emotional responsibility because you're sticking up for your loved one. You're sticking up for your loved one, how they feel, also maybe how you feel, what you need, etc. So let's go a little bit more into the challenging side of caregiving. So there's multiple challenges that caregivers face, as I'm sure all of you here know. But I think how you relate to the patient is going to, there are going to be different types of responsibilities. So you'll see overlapping responsibilities here, but you'll also see responsibilities unique to your relationship to the person with cancer. So, for instance, if you're caring for a partner, one of the most challenging components that I have seen is intimacy during and after treatment. Intimacy may look a lot different at this point in time compared to pre-cancer diagnosis. And it can be challenging to figure out what works, what doesn't work. Libido can change, fertility can change, and this can be really hard emotionally on the caregiver. Managing work for school with cancer treatment, I always say that cancer caregiving is a full-time job. So if you have a caregiver who already has a full-time job outside of the house, they now have two full-time jobs, and that is a lot to hold. As I mentioned kind of in the first point, caregivers may also face fertility concerns and preservations, particularly if we're thinking about a young adult couple where one of the partners is facing the cancer diagnosis and maybe has to think about egg or sperm preservation. Domestic responsibilities may shift drastically. Co-parenting may become more so like the caregiver is taking on more parenting responsibilities while the patient maybe is hospitalized, or maybe they're just a little too fatigued to do a lot of the responsibilities that they previously once did. Caregiving for a partner may feel isolating. You may have the inability to physically and emotionally connect with others of similar age. So maybe you used to be able to go out with your friends, or you maybe used to be able to go to a happy hour with your work team. And now you can't really do that because you have this whole other role and responsibility at home. And maybe your coworkers or friends might not understand that. They might, ask you, hey, why can't you take 5 minutes, 10 minutes, 30 minutes? It's not that simple. It's not that easy. And then while all this is going on, you may have challenges with engaging in your own self-care, pushing the self-care to the side because maybe you feel like you don't have enough time. Maybe you feel guilty about prioritizing yourself sometimes. You may have increased feelings of resentment, which is completely normal. And I think that this should also be identified because I think a lot of caregivers sometimes do feel a lot of resentment, and they feel super guilty about this because they think, well, I'm not the one with cancer. How can I feel resentful towards my loved one, of my loved one? And to me, I think that's you being human. You didn't ask for this, but again, you took on this major feat, and you're human and you're allowed to experience any type of emotion that surfaces. You may also grieve the life that you had pre-cancer diagnosis, of course. And then at the same time, you also may be experiencing anticipatory grief, which we can think about it kind of as the opposite of grief. You're grieving something that you had planned for the future, the present or the future, that you know will no longer be taking place. And that can be really hard to deal with as well. So in terms of caring for a parent, we're going to see a lot of similarities compared to the previous page and this page, but then we're also going to see some unique differences as well. So I think the biggest unique difference that we see is this concept of role reversal. So if you are taking care of a parent, so maybe you're a teenager, maybe you're a young adult, maybe you're you're an adult in your 50s and your 60s and you're taking care of your parent, we see this concept of role reversal happen. It's a situation in which two people have chosen or been forced to exchange their duties and responsibilities, so that each is now doing what the other used to do. So for instance, if you are a teenager and you're taking care of your parent by helping them, assisting them with ADLs, bathing, changing, for instance, we see this concept of role reversal, and that can be very emotionally challenging because maybe the teenager was not prepared for this. They were not prepared emotionally for this drastic change. While at the same time, maybe a parent was taking care of their child's children, so their grandchildren. Now they can no longer do that, and while they weren't ready to be taken care of, we now see this shift where their adult child is now having to bathe them, and that can be really emotionally challenging for the patient as well. So role reversal, no matter who's experiencing the challenges that come with it, whether it's the caregiver or the patient, it can just be extremely difficult across the populations. But in addition, like caring for a partner, we see increased feelings of fear, increased feelings of resentment, these changing family dynamics, the roles in the family. Communicating updates with family members can be particularly challenging as well. Trying to keep aunts, uncles, nephews, nieces, grandparents, great aunts, great uncles up to date. That can be really challenging to figure out, okay, how do I make sure that everyone is up to date? And how do I, as the caregiver, even ask for that help? That can be really hard. Again, you may experience increased feelings of guilt, kind of similar to that resentment factor that we were talking about in the previous slide. Of course, we see challenges with engaging in self-care, absolutely, isolation, and that concept of anticipatory grief. And then caring for a child. And I do want to preface this by saying that I'm not just talking about a child who's months to 17 years old. I'm talking even about a person who's 80 taking care of their child who is 55. So you can think about it from a few months old to 55 plus, it doesn't matter. But caring for a child can be extremely challenging. I think this is one of the most challenging things to face because who expected that one day your responsibility would shift in terms of taking care of your child with an illness? That's, it's awful. It's terrible. So, I want to kind of say that because for my parent caregivers on here today, I want to give you extra special applause because I want to let you know you're doing great. And this is a really, really hard feat that you've been taking on. But so again, we see that concept of role reversal, increased feelings of fear, changing family dynamics, communicating updates with family members. Again, you may experience those feelings of guilt, isolation, challenging with engaging in your own self-care, anticipatory grief, and a newer concept, infantilization. So, for instance, if maybe someone who is 80 is taking care of their loved one who is 65, we may start to infantilize them through taking care of them, treating them more so as a child or someone who is much younger than who they really are. This can either happen on purpose or by accident. But we do see this kind of role shift happen there, whether it is, to the pleasure of the patient, maybe they want that to happen, or maybe they didn't really expect it and maybe the caregiver wanted it to happen. So it's really interesting. And again, it can it can put a lot of emotional strain on that relationship. And it's really hard sometimes, particularly if the patient is in remission, to kind of get back to that regular family dynamic, if you will. So I know I've talked a bit about isolation and guilt and resentment and lack of self-care, but let's go into the specifics about what really caregiver burnout is. So it's the state of mental and physical exhaustion. And it's also known as compassion fatigue, particularly when a caregiver experiences burnout. You're caring so much for your loved one, both emotionally and physically, that you just get exhausted. You have no more compassion to give. So this can lead to feelings of guilt and anxiety, which can lead to poor health outcomes for both yourself and your loved one. So the common signs of burnout, at least from what I see as a social worker, are prolonged feelings of sadness, helplessness, hopelessness, and or anxiety, feeling tired or even after getting plenty of sleep. You may experience a lack of interest in doing things, neglecting basic self-care. You're getting sick more easily because your immune system is low. Maybe you have trouble concentrating. Maybe you even have trouble feeling motivated. May have impatience with the person that you're caring for. And then you could also experience changes in appetite. But so what leads to this? What causes all of these things? So it could be a myriad of things. I'm just going to go over a few today, but it could be lack of understanding your role. Maybe you're trying to figure out how to particularly care for your loved one when there's another primary caregiver in the picture as well. What's your role? Are you overstepping? Are you understepping? This can cause a lot of stress. Maybe you have unrealistic expectations on yourself, or maybe the patient has unrealistic expectations of you. So it's really important to identify what you can and cannot do. You're not a superhero. I know a lot of you probably, feel like you are, and I think you are, but at the same time, we have to also understand that we have to take it back a notch. We have to realize, nope, we're human. We can get burnt out. We can get to a social battery level of 0, and that's okay. That's okay, because we need to identify that and we need to address it immediately so that we can get back to 100%. So in addition, in terms of what causes burnout, you may feel a lack of control. I don't have control of this cancer. Oh my goodness. Therefore, there's just simply nothing I can do, and I'm just going to start panicking. I mean, that's typical anxiety, but anxiousness does lead to physical burnout symptoms as well. You may have unreasonable demands of yourself, or the patient might have unreasonable demands of you when maybe you can't do it all. And that's okay. Not prioritizing yourself and pushing aside your own self-care can also lead to burnout. You might think, oh, well, you know what? My loved one is going through a really tough time. I was going to take these 30 minutes to go to the gym, but you know what? I really need to get home and clean a little bit. Yeah, but at the end of the day, you're going to feel more exhausted and you're not going to therefore have the strength to kind of like get up in the next morning to do everything all over again. It's just a vicious cycle. So you need to make sure to incorporate any type of self-care you can, whether it's 5 minutes to an hour. And then of course you may experience like this insane feeling of isolation. Like I'm the only one taking care of a cancer patient, it feels like. No one understands what I'm going through. It's true. Maybe a lot of people that you know don't know what you're going through, but there are ways in which we can actually alleviate this or combat this feeling. I'll go into that a little more in the next few slides. And last but not least, you may just be experiencing a bunch of displaced or projected anger. You're angry at the cancer, so you take it out on your loved one. You're angry about the cancer, so you take it out on a friend. You feel a certain way about how the treatment is going, and so, you are explaining this all to the patient. Maybe the patient starts thinking, wow, yeah, these treatment side effects really suck. So now your loved one is feeling the same way that you're feeling because you basically projected your feelings. And that's not to say that you can't be honest with your loved one. In fact, I encourage you to be honest with your loved one. But I think it's also important to understand, okay, when should I be taking a step back and working on my own feelings about all of this before I start to blame anyone else? So now we're going to go into the coping mechanisms. So how do we deal with all of this stress? So, the biggest thing that I can recommend is individual counseling or group counseling, particularly for the people who are experiencing isolation. Group counseling is one of the best things that you can do for yourself because then you realize, wow, I'm not the only one. I am a group moderator, a caregiver group moderator at Cancer Care, and one of the main things that I hear from a lot of the caregivers that I work with is, I really thought that I was the only one. I really cherish this group because you all just get it. So group counseling, super important. Individual counseling, super important. Peer matching is also great, particularly if you want to speak with a caregiver who's kind of been in a similar position as yourself. This can also alleviate feelings of isolation. Maybe attending educational workshops, such as this one. Reading reputable cancer blogs, for instance, on websites like MSKCC, MD Anderson, etc. Connecting with the medical team. So really making sure that your questions are answered, that you get to know them very well, that they understand what your values and your goals are as a caregiver, also as a patient. So that means getting to know not only the oncologist, but also the hospital social worker, the nurse navigator, the patient advocate. And, start exploring caregiver-focused organizations. There are so many out there. The Family Caregiver Alliance, My Cancer Circle, and lots of helping hands. These websites are designed for caregivers to make your caregiving journey a lot easier. And practice self-care. Practice self-care. Stay active and move your body. This doesn't mean going on a 5-mile walk. Even doing a 10-minute chair yoga session is such a great way to get the blood pumping and just ease your mind, ease your stress. Make sure to eat a balanced diet. Practice good sleep hygiene. So what does that mean? Really quickly, going to sleep on time so you get that 6 to 10 hours, whatever your doctor says you need, not looking at your phone before bed, et cetera, et cetera. Utilize your support system. Reach out if you need assistance. Keep up to date with your own medications and medical appointments. Don't push your doctor's appointments aside. Set your boundaries. Say yes to yourself. Say no to others. Ask for respite care. And practice patience and kindness, both with yourself and with your loved one. And really quick, these are just some great mindfulness and grounding techniques. I love box breathing. So 4-4-4 means you breathe in for 4 seconds, you hold the breath for 4 seconds, you breathe out for 4 seconds through your mouth. Great way to help you stay present and keep you grounded. Meditation exercises that you can find online are body scans, guided imagery, taking a mindful walk. The 5-4-3-2-1 technique is a great exercise that uses all of your senses. Again, a great way for you to stay focused and present rather than worrying about a million and other things. And of course, my favorite is journaling. And these are just some other helpful resources that I encourage you to explore. If you ever need some extra support, if you are more of a researcher, these are some great websites to look into. And then I just have to quickly note about the services that Cancer Care offers because we truly are a great organization. Again, even though we're based out of the tri-state area, we still do help people nationwide. We do provide support groups, lots of helpful educational workshops and mindful wellness workshops that are called coping circles. We have a podcast. We have individual and group counseling. We have resource navigation, which is more commonly known as case management. We have limited forms of financial and copay assistance. And you can immediately talk with an oncology social worker who can get you connected to any of these resources. And if we don't have them, we can certainly get you connected elsewhere.